Kidney disease is on the rise because diabetes is on the rise, and it's the leading cause of kidney disease worldwide.
Muscle breakdown.
Yeah.
So if you're really pushing your muscles, going very intensively at the gym, you can see some creatinine in your urine.
Even creatine supplements can cause high creatinine levels. So that doesn't mean that the kidney is damaged. That's why we look at the whole picture. The thing with kidney disease is that you have no symptoms in the beginning. You only get symptoms when you reach stage 4 or stage 5.
What lifestyle advice are we giving this person? Because their goal, I imagine, is to try and flatten that rise of kidney failure, and so that they keep their kidneys as healthy as possible.
So I would say you need to work on your diabetes. And to work on your diabetes, you have to fix your diet and your exercise. Going on a walk is good, but going on a walk does not build muscle. We know that muscle is good for reducing your HbA1c levels.
Okay.
And in terms of diet, carbohydrates are the enemy. Protein is good for you. Carbohydrates is not good for you.
And today we have a very special episode for you, because for the first time we've got a special guest. We have with us today Dr. Arjun Sabharwal, who is a kidney doctor with experience working in India and the UK. And the reason that I've asked Arjun to join us today is because we can't go on treating the heart and health in just silos, looking at organs in isolation. And the heart is probably closely or best connected to the kidney.
Exactly, yeah.
They're a collaboration of sorts, and so I thought this collaboration would be a great way to dive into that. So that's the primary reason, but almost just as importantly, one thing that I'm a big fan of is your reach, or the way that you have been able to communicate health messages to people, to patients all around the world. And you've got 90,000 followers on YouTube. You've made hundreds of videos. And I think you're an inspiration for why Abhishek and I started this podcast. So it's great to see you in person and be doing this together.
Thank you so much, Nikhil. I really appreciate this. And I was looking forward to this collaboration because, like you said, the heart and the kidney are linked together. Patients with kidney disease actually don't die of kidney disease, they die of heart disease.
Yeah.
So having an opinion of a cardiologist is very good for the viewers and very good for the public to learn more about what happens in the kidneys.
Yeah. And often patients will come for their heart checkups, and you will see different medications, different tests, because they're seeing multiple different doctors at one time. Very few patients just have one issue with their body. They're often dealing with heart problems, kidney problems, lung problems. And if you're not in communication and understanding how all these systems work together, then patients do not get the best care. A heart doctor will end up stopping a kidney medicine and vice versa. And there is, in the medical communities, this rivalry between heart and kidney doctors about whose medicines are better, what is more important, the kidneys or the heart. And I think ultimately patients do best when doctors like us work together.
Yeah, I completely agree. And I'm sure all doctors want best for the patient and they're trying to do best for them. But it's the difference between knowledge and gap where maybe some medicines are stopped or some are started. And I think the best outcome for a patient is when they understand their disease best. Because if you're going through something and you know about it, then you'll take care of it. So I think that's why your podcast is really good. And I'm sure it's going to reach the masses to educate them about the heart and the kidneys.
Great. So what we normally do is we start off with a patient story. So I'm going to present to you a patient that we see in clinic quite often. This is a 60-year-old gentleman who has been told he's got kidney disease for many years. He goes to his doctor and has a blood test done every year. And there's always this red number with an exclamation mark next to kidney function. He's never really done anything about it, but today, for the first time, he's come to you to say, look, my kidney function has always been abnormal on these blood tests. No one ever says anything about it. What should I do?
So first thing is that he needs to see a nephrologist or a kidney doctor. A lot of people, what they do is they go to their GP or their family doctor and just start the medications which they give. It's important to see a kidney doctor because they can work up why the kidney is not working. And the thing with kidney disease is that you have no symptoms in the beginning. You only get symptoms when you reach stage 4 or stage 5. What stages are, we'll talk about that also. So I think the first thing is to go and see your nephrologist or a kidney doctor who will do an assessment of why this has happened, see a trend of what your kidney function was before, and then do some more tests in order to take this forward.
Yeah. So let's dig into what tests we could be talking about, because this gentleman as far as we know, is healthy,
Yeah.
right? He's active, he's running around, and it's just a blood test. And often the blood test that gets cited or that looks abnormal is the creatinine. And really, how should this person be thinking about that one blood test in isolation? What would you as a kidney doctor do to investigate this further?
So people see creatinine values and they panic. So they have to understand that creatinine is a breakdown product of your diet, high protein diet, your muscles. So just seeing a high creatinine level in your blood test does not mean you've got kidney disease. You have to see other things, for example, the urine, because whatever is happening in the kidney, you can see in the urine. If your urine shows blood or protein, means there is something happening inside the kidney. So another test that a lot of people have to do is a urine albumin creatinine ratio or a urine protein creatinine ratio to see if how much proteinuria or protein leak is happening from the kidneys. If it is significant, then we investigate, we do some more tests. For example, the most common causes are diabetes and high blood pressure. And we know that Indians, 100 million is the number recently that's come up, that approximately 100 million people in India have diabetes. That's like 10 crores or almost, I'm sure more than 10% of the population.
Wow.
So kidney disease is on the rise because diabetes is on the rise, and it's the leading cause of kidney disease worldwide.
Yeah, we've spoken at length about the reasons why diabetes is so common and such a big problem in Indians, why Indians are at higher risk of diabetes, hypertension. And I think it's these shared risk factors that link the heart and the kidneys to some extent. One thing I want to just explain to the viewers is why the heart and the kidney are linked. And I was thinking about this last night, and I think a good metaphor for this is if you think about a car or an engine, or really, you've got something being pumped around your body. That's the blood, and it's going around your blood vessels. And the heart is the engine of that machine. It's the pump that pumps that blood around the body. Now, one of the roles of the kidney, again, this is my simplistic view, is that it acts as a filter. It gets rid of all the toxins, all the dangerous materials that build up in the body and can cause harm. But also, it helps to regulate the amount of fluid that sits in that system. And so if you have too much fluid, then you can have a heart pumping away. But if there's too much fluid, then you're going to cause problems of high blood pressure, a lot of leaking, as you said. And if you have too little fluid in the system, then you're going to have low blood pressure. You're going to have not enough perfusion to the kidneys and all the other organs. So the two systems need to work together like a thermostat to regulate how much fluid is being pumped around and under what pressure.
Yeah, I think you explained it very well. And just one more thing to add is there's a lot of trends going on about inflammation in the body, and chronic kidney disease actually causes inflammation, and we know inflammation is not good for the heart also. So that's also one more mechanism how patients get CKD and heart disease together.
Yeah, the reason I wanted to talk about this is because you said you want to measure the urine albumin creatinine ratio. And that's because it leaks through the kidneys into the urine.
Yeah.
And from my understanding, that shouldn't happen. The kidneys are meant to be this delicate filter, but they're letting albumin and protein through.
Yeah.
So what's going wrong, and why is that happening? Why is protein leaking into the urine?
So let's talk about diabetes because it's the leading cause of kidney disease worldwide.
Okay.
So long-term diabetes, when your blood sugars are high for a long time, not controlled, it can cause damage to the filters of the kidneys.
Okay.
And the filter's job is to hold the protein and not let it go through the kidney. When the filters get damaged, then slowly protein leak starts happening. And over time, when the filters are completely destroyed, there is heavy protein leak. All major studies have shown that the more protein you leak, the more damage to the kidneys happens. So over time, and by time we're not saying overnight, it takes approximately 5 to 10 years for diabetes to start damaging the kidneys.
Okay.
So over time, the kidney function starts dropping, and you see a rise in creatinine levels. So it's all linked. And if you look at numbers of when it starts happening, an HbA1c of more than 7 is linked to kidney disease.
Okay.
So that should be everyone's target, to keep it below 7. Actually, it should be below 6, but to keep it below 7 in order to protect the kidneys is crucial.
So it sounds like if this person comes to you with a high creatinine or a rising creatinine, you would say, let's get a urine albumin creatinine ratio. You'd want to check them for diabetes. What else would you look for?
So we also check for hypertension. High blood pressure is the second most common cause of kidney disease worldwide. And then third things are diseases inside the kidney. So we call them autoimmune conditions where your body is attacking the kidney. So one very common condition is IgA nephropathy, which happens when you are young, in your 20s. most people don't have any symptoms apart from high blood pressure. And if they get the urine tested, they might see some blood in the dipstick. So a dipstick is a very cheap test, which you can just take a urine sample and there's like it's similar to like a litmus paper. You put it in and it can tell you if there's any protein or blood. So if there's blood, high blood pressure, and if you're young, then that's one thing we suspect. And the next step would be to do a biopsy, a kidney biopsy, to find out what's actually happening inside the kidney when we're not sure about what the cause is.
Okay. I guess we're going many steps down the line here because that sounds quite invasive. But I think for our listeners or viewers, the important thing to remember is that is what happens if you're showing more positive findings along that way. A lot of the time you can have an abnormal or raised creatinine and all these tests you do will come back negative. And that's reassuring to a doctor because it means that you don't have a more sinister cause for that high creatinine and the kidneys are generally not doing as badly as we thought. And I know that you can get a high creatinine from medications if you're taking the wrong medications, if you're taking too much medications. Ibuprofen is commonly one which can cause some problems with the kidneys. Also, if you go on very long runs, if you're really pushing yourself, you can really damage, because as you said, creatinine is a muscle breakdown. So if you're really pushing your muscles, going very intensively at the gym, you can see some creatinine in your urine.
Even creatine supplements can cause high creatinine levels. So that doesn't mean that the kidney is damaged. That's why we look at the whole picture.
Yeah.
And just to come to your point about the biopsy, it sounds invasive and it is invasive, but actually the risk of something detrimental happening from a biopsy is quite low. So if a doctor is recommending a biopsy to you, they must have thought about all the other factors. And they're recommending because it's good to get a diagnosis, especially with all these new treatments coming up. They all required a diagnosis which has happened after a biopsy.
Fine. I think it's similar to cardiology because someone can have an ECG done and that can show an abnormality and they can get very worried that, oh, I'm going to have a heart attack. But actually, that abnormality on the ECG just means you need to have a number of other checks done. Sometimes it could be just a review, a detailed history from your family history. It can sometimes be an echo scan to look at your heart strength and shape. And often if those all come back negative, you don't need to keep escalating things to our final tests, which are also the more invasive ones. And often that abnormality seen at the front door can be something benign, which means it's something which we know about and we can be reassured that there's nothing underlying it that's dangerous to the person.
So tests are good. Same with kidney disease. You will never know you have kidney disease till you get tested because there are no symptoms in the beginning. So even for cardiology, if something comes up in the ECG and your doctor says we should do the other tests, it's not to make money. It's to find what is happening and protect you. It's like prevention.
I suppose because it's a risk-benefit decision. Okay, so let's go back to the heart, and if you're having an ECG done, there is risks of having an ECG done. You might have a reaction to the stickers, but the bigger risk is in a very small number of cases, you might find something called a false positive, which is where a doctor will think there is something there when there isn't, and you end up having lots of tests done. You have to come back in, spend money, as you say, on these tests, and everything, it goes on. It takes up a lot of time, causes a lot of anxiety, and there's also risks with some of those tests downstream. But the benefit of having that test is that if you're one of those very small number of people who do have an abnormality that's not causing any symptoms, it's picked up early. And going back to your examples of diabetic kidney disease, hypertensive kidney disease, IgA nephropathy, there are treatments and ways that we can manage these things. So the risk of not getting the test done is outweighed by the benefits of finding those rarer conditions.
Definitely. Just to coming back on the ECG part, most people don't get ECGs done. However, it's a very basic test to be done, very low risk. I know you spoke about the reaction, but the risk is very low. And you'll see a lot of people having sudden cardiac arrests in India or so-called heart attacks in India. That most likely is a conduction abnormality, right? Where the wires of the heart are not working properly.
Yeah.
What do you think in those?
So screening for heart disease is something which is a little bit controversial on a global scale because we understand that we can pick up these abnormalities, but on a national level, the government has to make a decision: is the cost justified by the risk? And that's a conversation that will continue. I think on an individual level, we also need to think of, would I as an individual want to have an ECG done for me? And especially if you have a family history of any heart problems, a family history of any chest pains or heart issues in a younger age, or if you have any symptoms of dizziness, chest pains, shortness of breath that's unexpected, the risks of getting an ECG and the cost and the time is incredibly small.
Yeah.
So again, everyone has to make that individual risk benefit. And especially if you're an active athlete or if you're someone who does a lot of exercise, in the UK, there's a lot of national screening programs for sports players because of the extra stress that's put on the heart. And so I think certainly anyone who is active or planning to do something stressful, like climbing a mountain or going off to run a marathon, you can really justify getting that ECG screening test done in the first instance.
Yeah, just for prevention. Yeah, definitely. I agree with you.
Yeah, so I guess going back to our 60-year-old gentleman, if he's had his creatinine checked and he's having it monitored, and let's say nothing else comes up underneath, I think it's important that he doesn't then forget about it for the rest of his life, because as you said, this blood test is a trend.
Yeah.
And in some ways, heart disease and kidney disease are diseases that continue. They're diseases of old age. They're chronic conditions.
Yeah.
And if we all live for long enough, we will all develop heart disease and kidney disease. And so I guess the blood test is just a marker of where you are on that spectrum. We all have a little bit of nephron death, so your kidneys gradually starting to weaken.
Yes.
And I guess the question is, will that become significant before the end of your life or not? And so that's why we should keep an eye on that creatinine. Is it going up gradually? Is it flat and stable, or is it something that is reacting in a way to a new medication that's been started? So for this person in their 60s, I would certainly say that there is rationale for repeating it further down the line again.
Yeah, definitely. I think the 2 points you made was one is loss of kidney function with age. Just to touch on that, after the age of 40, your kidney function drops by 1 point every year.
Okay.
So if you're 80, your kidney function will not be 100%. It will be lower than that, and that's absolutely normal. Diabetes is accelerating that risk. It is dropping your kidney function faster if it's not in control. And I think the other point you're trying to make is about follow-up. Follow-up is crucial, and it's often not done because patients feel, I've seen the doctor once, they've given me the medicine, what's the point of seeing them again? Well, it is important because, like you said, these medicines can need to be adjusted. They can damage the kidneys. They can cause change in the kidney function.
Yeah.
So follow-up is crucial. And for a diabetic who's well controlled, you need to see a doctor at least twice a year. If your HbA1c is more than 7, then probably you need to see them three times a year, so that they can check your urine albumin creatinine ratio, your blood creatinine levels, to see the trend over time, if it's getting better, if it's getting worse. Because what we'll discuss in the next episode, there are a lot of new treatments now for diabetic kidney disease, which were not there before. So I think there's hope for patients that I would say this is the best time to have kidney disease or a best time to be a kidney doctor, because there were no medicines 10 years ago.
Yeah, so we've come a long way. And I guess, again, a final point for this gentleman here who's got the abnormal creatinine. I always see on the creatinine there's another number below it, and that's, if anyone is looking at their blood test results now, you'll see something called the estimated GFR, glomerular filtration rate. Can you tell me a little bit about that and why that often goes hand in hand with the creatinine?
So it's very important. eGFR is very important because our treatment decisions are based on eGFR. So just to give you an idea, eGFR depends on your sex, so male or female, your age, and your blood creatinine levels. So at times it can be inaccurate because we discussed before, creatinine levels can rise after exercise, after creating supplements, so your eGFR can come down because of that. So there are 5 stages of kidney disease based on the eGFR. If your eGFR is more than 90, you'll be able to see all of this on the screen also. But if your eGFR is more than 90, but you've got protein leak, you still have CKD stage 1. Similarly, if your eGFR is less than 15, then you've got CKD stage 5 or end stage kidney disease.
Okay.
And in the middle, you can see stage 2, 3, 4 based on your eGFR.
Okay. So for this gentleman then, let's say he's got a little bit of a raised creatinine that's been stable. So maybe he's in that CKD stage 1, maybe CKD stage 2. What lifestyle advice are we giving this person? Because their goal, I imagine, is to try and flatten that rise of kidney failure, and so that they keep their kidneys as healthy as possible. So for someone who is healthy, living an active life, what would you tell them, aside from coming back to see you for a follow-up appointment, to try and keep that creatinine as stable as possible?
So I would say you need to work on your diabetes. And to work on your diabetes, you have to fix your diet and your exercise. Going on a walk is good, but going on a walk does not build muscle. We know that muscle is good for reducing your HbA1c levels.
Okay.
Even for reversing diabetes, muscle is good. So I would always tell my patients to start going to the gym. Start lifting some weight. Even if it's like 5 kgs, it's good for you. And in terms of diet, carbohydrates are the enemy. Protein is good for you. Carbohydrates is not good for you. So a lot of patients think that if they're leaking protein from the urine or from the kidney, they should stop eating protein, which is actually the wrong thing to do, because then you lose all the muscle in your body. So your blood creatinine levels will come down, but the protein leak will not make any difference. So you need to have up to 0.8 to 1 grams per kg body weight of protein. So if you're 70 kgs, you need to have around 60 to 70 grams of protein. So low carbohydrates, high protein, start going to the gym, and you will see in 3 months your HbA1c levels will come down.
Okay, so diet and exercise.
Yeah.
And then tell me about non-steroidal anti-inflammatory drugs like ibuprofen, because I don't know where the threshold is for what is allowed, what is not allowed. What do you recommend to people who come to see you who are otherwise well?
Well, if you take them for long, for example, if you're taking them every day for months, it will definitely cause damage to the kidneys.
Okay.
But if you're taking it short term, probably 2 or 3 days in a month or in 2 months, then it's relatively safe, especially if you don't have CKD stage 4 or 5. In 4 or 5, we recommend not to take it.
Okay,
There are
fine.
other medications that you can take instead of ibuprofen.
Fine. So for this person, keep a good diet up. You spoke about the importance of high protein, lowering the carb intake. You spoke about the importance of muscle-based exercises. We spoke about avoiding chronic ibuprofen and NSAID use. So that's a good actionable steps for anyone who's listening who wants to try and stabilize or lower their risk of developing CKD as they grow older, or if they do have those early stages, to try and flatten that curve. Great. I think we'll leave it there for today.
Thank you.
Thanks. Just in the last few years, these medications that are working for kidney disease have also been shown to work for the heart. So again, another reason why closely working together is really important.
Yeah, definitely. And then the next one is the one which is in the news a lot, Ozempic or GLP-1 analogs. Now I've seen a lot of health influencers saying that Ozempic is not good for you. Well, I agree. If you're taking it before a wedding just to lose weight, it's not good. But if you're taking it for kidney disease or heart disease, where the first 3 lines of medications have worked, but still you've got excessive protein leak or your risk of heart disease is high, then I think it is a good medicine. Definitely in someone who's trying to lose weight.
And so sometimes the patient is best placed to say, hold on, this is what I was told to expect. In an ideal world, the system would be better connected. The doctors would be able to communicate and share information. But sometimes the patient has to be their own advocate and understand that this is what's going on.
Yeah, that's why you need to subscribe and watch this podcast so that you learn more about these medicines and you get more knowledge about kidney disease.